Thank you all for joining Congresswoman Kelly's Black Maternal Health Week listening session. My name is Megan Thompson, and I'm Congresswoman Senior Health Policy Advisor. And I'm excited to provide commentary for this conversation. Addressing the challenges that women face in receiving quality maternal health care is an issue that Congresswoman Kelly is deeply passionate about and has spent years advocating and successfully enacting legislation into law, and such as ensuring that states have the option to expand postpartum coverage for 12 months after delivery. Congresswoman Kelly is a member of the House Energy and Commerce Committee and serves on the Health Subcommittee. Additionally, she serves as the chair of the Congressional Black Caucus Health Brain Trust, co-chair of the Congressional Caucus on Black Women and Girls, and co-chair of the Bipartisan Maternal Care Caucus. Congresswoman Kelly is committed to improving the health and wellness of vulnerable communities across this country. Thank you, Congresswoman, for prioritizing these crucial conversations such as this one here today. Additionally, just flagging for everybody, we will need to keep the conversation to 30 minutes. So thank you all for being here, and I will turn it over to you, Congresswoman Kelly.
Thank you so much, and welcome. She's new, not new to us, but new to the position. So thank you guys again for joining us. I am passionate, about this topic. And I admit to people, I didn't even realize until I came to Congress that it was even a problem. I was shocked. A constituent called me and shared the story about Judge Hatchett. We had Judge Hatchett come in, I think it was December 2016, with her son, Charles Johnson. And that's where it all began for me and the work that we've done. So I just want you guys to go around and just introduce yourselves and talk a little bit about what you're doing. And then I have some questions I know you guys can handle for you. So Star, if you want to start.
Sure. My name is Star August Ali. I'm based on the South Side of Chicago. I happen to be a CPM. I'm actually the first and only Black CPM in the state of Illinois, the only one that's currently eligible to practice in the state. I've also been a doula for over 10 years. I'm a mom of 4 young children. Got involved in this work because I had a horrible outcome with my first child. They actually almost killed him. So I've been actively fighting in this space. I actually own a nonprofit by the name of Holistic Birth Collective, who has pushed 3 different pieces of legislation, 2 of which the governor has signed recently, enacting it to address these matters here. Have a current bill right now that's in the House that we're also pushing to address this as well. So looking forward to this conversation today.
Thank you so much. You are a glass ceiling breaker.
Thank
Dr.
you.
Hello, good morning. I'm naturopathic Dr. Mai Heath. Happy Black Maternal Health Week 2023. Very happy to be back again. I'm a naturopathic doctor, a doula, a childbirth educator, and a proud member of the Congresswoman's Black Women and Girls Task Force. I'm also the founding director of Doula Community Alliance. It is a social justice and healing justice organization aimed at addressing the quality of life gaps of Chicago's marginalized communities. So happy to be here today.
Happy to have you. Isis?
Good morning, everyone. It's really nice to meet you. Is it Mai or May?
Mai.
Mai, nice to meet you. I know Star, we met actually in 2019. I am following in her footsteps and hope to be the first Black CPM serving the Central Illinois region. So I'm based in Urbana-Champaign. I don't know if I said my name. I'm Isis Rose. I'm actually a doula, student midwife, and I'm also the co-founder and executive director of BIPOC for Better Birth. And our purpose is to provide free and low-cost training for people who aspire to become doulas, midwives, childbirth educators, lactation specialists, and herbalists, and anyone else who's willing to serve families in the childbearing year. And so I'm just really excited to be a part of this conversation. BIPOC for Better Birth is a nonprofit organization, and we're very new, but we are already hitting the ground running, and I'm just really excited to be in network with you all.
Well, again, thank you all for joining. You're all phenomenal women, and my sheroes, for sure. So thank you for what you're doing. It was actually very alarming to see the CDC report that more women are dying, even though we seem to be talking about this a little more, it's on the news, people are a little bit more knowledgeable, but more of us keep dying. I mean, it just does not make sense, representing a 40% increase from in 2021 from 2019. That is just so crazy. And the US rate, for the richest country in the history of the world and an industrialized country, these statistics are just unacceptable. That's just the bottom line. And I was interested to know, COVID-19 really exacerbated a lot of things. And how do you think that when it comes to this issue, what did COVID do? How did it hurt us, I guess I would say, even more?
Well, if you don't mind me taking this one. Okay, so I know specifically for COVID-19, there was a huge uptick, specifically of Black women of color requesting out-of-hospital options, right? We have these stats. Every woman that's quote unquote in childbearing age kind of knows what's going on, right? So people are actively trying to get out of this system. So it went from essentially, there was 51,642 home births in 2021, with an increase of 13% in 2020 to 45,000. This increase followed by a 19% rise in the number of home births from 38,000 from 2019 to 2020, right? So Black women are demanding home births at an astounding rate. We're trying to get out of the hospital, but there really isn't anything really put in place to support this. As you know, Illinois the governor just signed our bill last January to enact so CPMs could practice in the state. We're still going through the rules and regs, so we're not actually legally able to practice, but there's still a huge demand of people that want out of hospital options. Isis may be able to know this as well. I'm sure she probably has people contacting her. Even though we can't technically practice in the state, people are still calling us. And the other side of this issue is that they cannot get a Black midwife because a lot of them want congruent care. Then they're essentially going to have an unassisted birth, which brings a whole bunch of other issues with it as well. So I feel like the answer to all of this is really investing into community birth options, because we know that hospitals are dangerous. So what other options are on the table? This would be home births, and this would also be birthing centers. Now, CPMs are a new emerging industry in the state of Illinois. This should be a top priority right now. So my organization essentially has started conversations with the Chicago Community College Systems and Chicago State University to get a direct entry midwifery program installed in both of those systems, produce community midwives within 2 years with financial aid under $12,000 on the ground within 2 years. This should be a top priority because people don't want to go to the hospital. We consciously know what we're walking into. So what other options that we have? And something that Mai said, that I've heard her say before, is that whenever there's a lack of options, that's another form of oppression. That's very true. So we don't have options on the table. What other options do we have? So if we don't want to go to the hospital, a lot of us are going to free birth. I can bear witness to this. My third child, I free birth. I was not going to the hospital. They already killed my first one. So what other options do I have? Consciously knowing what's going on. So I think that we really need to look at the fact that people don't want to go to the hospitals. What other options can we invest in? And right now, the investment really should be in growing and diversifying the midwifery working force. This is getting Black women in our own communities up and working, serving ourselves, because that also takes away the racial bias that we're facing in the hospitals as well. Because as we know, our team Backwards to Thrive, 79% of the births, the maternal deaths were deemed preventable, right? For Black.
I think higher than that, even 80 to 84%. But let me ask, well, two questions. One is, when I talked about how did COVID hurt, but also one thing that came out of it was telehealth. And I know when I spoke to my doctor, she said she even used it more, of course, not to deliver, but that was helpful. So that's one thing. Do you feel like that's been helpful? And then the other thing is, how many birthing centers are there in Illinois?
Yeah, I want to just piggyback a little bit on what Star said. I also agree that letting people have options to birth outside of hospitals is important. And there's also a gap there. I think creating more awareness and explaining to people what those options look like. Because, we, Black people, we birthed at home for centuries, right? Forever. And there was that shift when that kind of medicalization of birth happened and it was started to be looked down upon. And I think there are still remnants of that today. So there's the onus is on us to really explain to the general population what their options are and what birthing outside of hospital would look like and who's eligible for that. And that quote that she brought up is one of my favorite quotes. That's a quote by Bell Hooks. And that is, that idea that being oppressed is a lack of options. So I've always taken that to mean that, having more options is, helps folks to access freedoms. And along with, having options for birthing outside of the hospital, during that perinatal time, that is a time when folks are more interested in holistic, alternative, naturopathic, integrative medicine options because they want to put less in their body, less chemicals in their body. Mm-hmm. So, Illinois is not a state that licensed naturopathic doctors. So I think having more, integrative medicine options so that people can, just be more integrated into the system and feel more like they can influence their own health outcomes. Mm-hmm. I think that we're going to see positivity in that way. And naturopaths are a group of practitioners that have long used telehealth appointments. Naturopaths don't deliver or don't receive little ones. So that's something that I think COVID has really kind of pushed to the forefront. And that is a technology and a option that I don't think we're going to lose. I think they'll be charging for it more and things like that, but we've got the portal, we've got, email to speak with our healthcare practitioners. So, it left a lot of people sitting back thinking like, okay, hey, why was I coming into the healthcare center in the first place when some of these things could have been done out of hospital, especially when we put a lot of pressure on folks to make these in-office visits 2 weeks postpartum and other things like that. It could be really taxing on them. So I don't think telehealth is, going anywhere. I hope it's not. And I hope we can only just have more innovations. And that is one of the bright things that came out of COVID for sure.
And listening to you guys, and Isis, I'll get to you, is we need to be our own best medical experts and learn how to speak up for ourselves also and ask the questions and those kind of things. Isis, we've talked about this a long time, very concerned about rural areas or outside of big city, limits and things like that. And, just the access to healthcare in general, but then definitely when it comes to this issue.
Absolutely. One of the reasons why I love doing this work is because I can be a voice for people that are outside of the larger city centers that get a lot of funding and a lot of energy. I love you guys, like energy and enthusiasm, because downstate in these parts, it's like, I feel like I'm just yelling into a tunnel, like, where is everybody? Like, do you hear me? But you're right. I mean, rural communities and smaller cities have different concerns. And I think so many people still lack awareness of what their options truly are in the state of Illinois. And I know that when it comes to doula work, when it comes to learning what all of your birthing options are, there's a lot of consciousness raising that still needs to be done. In terms of COVID and telehealth, I think we all started to witness the weakness, right? The very fragile foundation that our society is built upon in terms of our medical system, in terms of childcare, like all these things started to get really. We saw them under a microscope, the weaknesses and the inefficiencies. But I think, in thinking about maternal health, we also saw people being really creative. We saw people, advocating for themselves by choosing to birth elsewhere when they knew that their partner or their doula couldn't be in the hospital with them. I think we've also seen that with fewer interventions, medical care costs go down. And, I think that with the rise in more support for physiological birth, we're seeing a decrease in major abdominal surgery, which is a huge thing. And that's hospitals' bottom line. And they've actually had a few, and by a few, I mean literally 3 in the last year, L&D department closures in this area, so people are shutting down their labor and delivery departments because it's too expensive to maintain L&D departments, and they're not making the money that they need to make because of the shift that's happening in childbirth, and I think these are positive shifts that should happen, but it's not sustainable for our current medical model. And so thinking about our options and reducing, maternal mortality and morbidity, that has a consequence. And so we have to think about, what does it look like when a labor and delivery unit gets shut down and now people are out of options, but then they don't have enough midwives to sustain providing care and attending births in their community. People have to drive to whole other counties to get the care that they need because it's low resourced out here.